I'm going to talk about Tai Chi for health. And I'm going to start with what is Tai Chi and the Tai Chi for health programs, and then the benefits of Tai Chi for health programs, the evidence, and then I'm going to have time. Let's try that. So what is Tai Chi? Is it a martial art? Is it an exercise? Is it a philosophy? Is it a way of life? Is it an understanding of nature? It can be all those. What I'm going to show you is how anybody can learn Tai Chi. But let me start with, there are many different styles of Tai Chi. The original style, Chang style, is vigorous. It has force delivering move, it has jumping, and it has fast punching. And the most popular Tai Chi that you see are more the gentle, open, expansive. And that's the Yang style. And then there's the healing and relaxing Sun style. And there's the Wu style. And there are many styles, and within each style, it can be very different. Because most people now use Tai Chi to improve health. That Tai Chi is one of the most effective body-mind exercise. And there are many scientific studies that have shown the health benefit of Tai Chi, and I'm going to share with you some of those. Let me go back to the traditional Tai Chi. They are mainly designed for martial arts. Are originated from China, and they can be quite complex. When the purpose change, when our purpose is health, and if we focus on health, and we're not using Tai Chi for martial art anymore, then we need to modify that. Nowadays, we have a lot of medical knowledge about coaching, learning. So if you incorporate those knowledge with the traditional Tai Chi, then we can create something that's much more suitable for the need of health. An ideal Tai Chi for health program should be easy to learn, it should be effective for health, and it should be safe. And let me explain each of them. Let's start from being effective, especially for health departments and the health professionals. Medical evidence is very, very important, because the medical study has a very objective and accurate look at how things work. It's the best we can rely on. However, having said that, in terms of effective, it's also very important to have that experience. I've been a doctor for well over 30 years, and a lot of times I fall back on my experience. When I look at people, especially when you look at the real person, experience becomes a very important point. The second point is about safety. It makes sense if you're doing Tai Chi for health, it needs to be safe. And you do remember the traditional Tai Chi were created for martial arts, or mainly for martial arts. So you can imagine there are movements that may not be as safe as you want to be. You can see the jumping, the fast movements can have high risk, but you might not realize a very gentle movement like a Yang style, turning, that actually can carry a high risk. Why? When your weight's on the knee, and when you turn with that weight, you grinding the knee, and that gives a lot of strength to that cartilage in your knee. So a Tai Chi for health program, ideal Tai Chi for health program, should take away those high-risk movements. It should design so that it's as safe as possible. The next point, which I think is just as important, is it needs to be easy to learn and it needs to be enjoyable. Our study has shown Tai Chi for arthritis, it can take a few days to a few weeks, and at most a few months to learn. So it's relatively simple. And our studies show that benefit come after 3 months or even earlier. So that is something anyone can learn. That's something that anyone can gain benefit very quickly. Part of being easy would help people to feel that they master the art. And when people learn something and they feel they have mastered it, they enjoyed it more. Even if you learn something very simple, once you learn it, you feel good and you enjoyed it more. So the other point about Tai Chi is it's intrinsically enjoyable. That's so important. You give people a perfect exercise, if they don't do it, it's not going to help them. But if it's something that's enjoyable, like many of my Tai Chi friends, we are almost addicted to Tai Chi because we enjoyed it. I'm going to talk to you about the benefit, and I'm going to quote the American National Center for Complementary and Alternative Medicine. It's a weight-bearing exercise, and therefore it's good for the bones, it's good for osteoporosis. And it also is an aerobic exercise, means that it increases the cardiovascular fitness. And other things at least improve physical conditions, muscle strength, coordination, and a whole host of other things to have better balance, lower risk of falling, and to ease pain. So it goes on, and I love the last two, to improve sleep and the overall wellness. I think that's most important, to feel good about yourself. I just want to share with you how many of my friends get together and we enjoy Tai Chi together. And I'm very proud to bring the ancient art of Tai Chi to the oldest university in the world, the University of Bologna, which is nearly 1,000 years old. There are plenty of medical studies on how effective is Tai Chi. I'm just going to give you a few examples. Mostly these examples are to do with the Tai Chi for Health programs. When you look at evidence, you also need to look at the reasoning behind how things work. We know exercise works. We know an exercise that engages the mind would help to strengthen the mind, which means it helps you to relax more, help you to concentrate more. It makes sense Tai Chi is going to help you physically and mentally. It's good when the reasoning is right, then you know you're in the right track. The last bit I talk about experience. It's really important to actually see it happen. And once you tried it, you experience it yourself. I'm going to introduce a government body called ACC New Zealand. It's not only a beautiful country, it's visionary. It has a national government body called Accident Compensation Corporation. And it has a non-fault policy. So it doesn't matter what sort of injury. If you fall down at home as a housewife, if you have a car accident, you have a work accident, and in fact, if your doctor treat you wrongly and he removed the wrong kidney or something, hope that never happened. ACC take care of you. Isn't that wonderful?